Now, interpersonal violence, obesity, blood pressure, unsafe sex, and alcohol consumption are the top risk factors for disease and death in South Africa. This emerged from the latest report of Burden of Disease Research Unit in the South African Medical Research Council. Joining us now to explain why this study is different from previous reports is Unit Director for the South African Medical Research Council, Professor Bradshaw. Prof, good evening. Good to have you, and thank you very much for your time. Medical researchers, of course, decided to conduct this study. It could be, and you'll tell us, for one reason. One, they are of the view that we are currently not highlighting what are the underlying causes of death and diseases in the country, and therefore we don't have a clear grasp on them. But number two is to get lawmakers at least to prioritize these particular areas. Am I correct that is the sum of what you wanted to do with the study?
That is correct, yes. Good evening. Most of our work has looked at what are the medical causes of disease and death. And what we did in this study was to take it a step further and try and understand what are the risk factors that can be changed that are driving the disease and premature mortality in the country. So, as you said, things like interpersonal violence, unsafe sex, high blood pressure, those risk factors which we do consider can be prevented.
Yeah. So you looked at, please explain to us what the difference is here. Lost disability adjusted life years, and what else you looked at is life lost due to premature mortality. How does that work, and what exactly are you looking at there?
So the unit of measurement that we've used for the burden of disease is what we call adjusted life years. Because we want to combine the time that's spent with illness that disables us, as well as the time that we lose if we die too young. So those disability adjusted life years measure the combination of both illness and premature mortality.
And you have then reduced the underlying drivers to what we've already mentioned. So what are your findings? Firstly, before we get to the findings, I find it interesting that you're covering the period 2002 to 2012. Now, we know what 2020 brought to us. Could factoring that in maybe could have come up with a different kind of outcome as far as these results are concerned?
Yeah, so a limitation of our study is that it's historic and it's showing us the trends in those risk factors. And we saw that by 2012, unsafe sex was the by far the most important risk factor that needs to be addressed to reduce the burden of disease. And we do believe that by 2020 and after COVID, that unsafe sex has probably become less dominant. It's still a leading risk factor, we're pretty sure, but the data that we've seen beyond our study would suggest that it's a leading risk factor of similar order of magnitude. So the COVID period has probably accelerated the cardiovascular risk factors, overweight and high blood pressure, diabetes. So we would dearly love to be able to update the study, but we need more data to be collected on the illness patterns and risk factor patterns in the country.
Prof, just comment for me on the unsafe sex risk factor. Is it as a result of unavailability of condoms, or is it a result of unwillingness to use condoms?
To try and influence sexual behavior. There has been a massive increase in the use of condoms, male condoms, but there's just the infection spread through the country before COVID, but it spread wide, and the extent of the burden was really profound, and so we still have it's been reducing, but we still have it as a leading risk factor, and we do think that there's room for reminding people that they should know their status, they should protect themselves, especially if they have multiple partners. There's room for male medical circumcision. It's been shown that played a role in some of the provinces. And getting onto treatment, it reduces the viral load very significantly to be consistently on treatment as soon as possible. And that slows down the spread of HIV as well.
Professor Debbie Bradshaw, appreciate your time. Thanks so much for coming on and highlighting this intervention for us tonight. Director in the Burden of Disease Research Unit at the South African Medical Research Council, Professor Debbie Bradshaw.